Hello, this is Ariel Wilson-Harris, Communications Director for Metropolitan Human Services District, and we are here to advocate for getting vaccinated, protect your neighbor. We're here with the lovely Dr. Michelle Easton. Dr. Michelle Easton, how are you?
I'm doing great. Thank you.
Good, good. Thank you so much for joining us. Can you tell us a little bit about your background?
Sure. I am a licensed pharmacist. I spent about 20 years in academic pharmacy in different roles, teaching future pharmacy students. I was involved in teaching med students and PA students and nursing students about pharmacy and about collaboration, teamwork, different things like that as health professionals. I'm also a certified mental health trainer. I enjoy sharing the importance of being able to recognize when someone may be struggling and in need of help, and how and what do you do. So that training has been extremely helpful for me to one, for myself, but also to share it with other people. And I also have my own consulting business when I do some leadership training, development, facilitate meetings, retreats, different things like that. But I'm a native of New Orleans, or I should say Nolans, and I've just recently returned back to the Big Easy.
Oh, well, we are so happy to have you back. We love our New Orleans native leaders out there. So thank you so much. So that really brings me to my first question, right? We are in the pandemic and we're still here.
Yes.
There's a lot of guidelines that have been lifted and there's things that are no longer in place. So obviously we're experiencing some high anxiety and questions. So tell me, how would you relate mental illness to the pandemic, and what are some things that we should consider to really understand that could possibly lead to a mental illness now that we're getting back to the new norm?
Sure. One thing that I think the pandemic has shared with us and has taught us, at least I hope we're all learning this, is that mental health is important, and that just as important as your physical health, your mental health is as important. In my instance, I'm a trained psychiatric pharmacist. So I'm a little biased in that I think mental health is the most important thing to take care of first, because once you have good mental health, then you're able to more clearly, more effectively take care of other parts of your health. But what I think the pandemic has pulled back is that there's still huge stigma around mental health. And that the pandemic has, in some instances, exposed person's vulnerability. What I'm hoping comes from this is that we reduce that stigma a little bit, and we recognize that we all have feelings and emotions, just as you have hypertension, diabetes, other illnesses of the body. You can also have an illness of the brain, but there's still hope, because there's treatment is effective, and that we should be paying attention to our brain as much as we pay attention to any other organ in our body.
Yeah, it's funny you say that, because I don't think people relate mental illness to an actual illness. Like, it's just like if you were to treat cancer with chemo or
That's right.
Different things, So, and we now have Claire who's joined us. Claire.
Hi, Claire.
Hi, Dr. Easton.
Yes, Claire Bivens is our amazing communications specialist here at MHSD. Claire, do you have a question for Dr. Easton?
Not yet. I mean, you guys were kind of just getting started, but I definitely will chime in because I know she's got some good stuff.
Okay, awesome. So one of the next questions would be more so about, if you've come in contact with someone who's tested positive for COVID-19 and you're vaccinated, how should you interact with that person? And also, if they've tested positive, should you go ahead and get tested again? Like, what do you do in that instance?
Excellent question. I think the key and the best part of that question was you're you've had the vaccine, right?
Yes.
So because you've had the vaccine, you've done all the right things that we can do at this particular point as it relates to protecting ourselves from COVID, and that is to get vaccinated. Once you're vaccinated, you're protecting yourself, and so because you have that protection, the vaccine has primed your immune system, so it's ready if you should be exposed to COVID. Your body is ready to fight it. And so if you are vaccinated and you come into contact with someone who's COVID positive, your body should be able to protect you from getting sick. Now, we know that vaccinations are highly effective. The 3 that we have on the market in the United States have very high percentage rates of effectiveness, but they're not 100% effective. So you may be in that small percentage, that 2, 3, 5% of persons who may actually get COVID, even though you've had the vaccine. The positive thing, or the positive consideration, is that what studies and the research has shown us is that if you are infected by COVID and you've had the vaccine, that the case that you have will likely not be serious. In other words, you may feel poorly, but you will not get to the point where it's life-threatening, fatal, have to go into the hospital, on a ventilator, any of those types of things. So you shouldn't have to go and get a COVID test. Because if you get a test, it's going to show that you have the antibodies, right? It's more important that just check your symptoms. If you're feeling bad, if you're low energy, if you have a cough, if you're running a fever, then you may have been exposed, and and as long as it does not increase to a very bad situation, then there's no need to go to the hospital or anything like that. No need to get tested either.
Got it.
So Dr. Easton, one of the things that I heard, and I'm sure many others heard at the start of the pandemic and even throughout, was that medications such as Tylenol should be avoided. So I'm wondering, are there any over-the-counter or prescribed medications that we should be aware of that may negatively affect us if we're vaccinated?
Good question. Let's go with the prescriptions first, and then I'll do the over-the-counter. So if you have a physician who has prescribed medications for you to take for chronic conditions, for your blood pressure, for your allergies or things of that nature, unless your physician says otherwise, you should continue taking those medicines. There has not been any data to show that there's an interaction that would be negative once you're vaccinated from taking prescription medications. If, for example, you take blood clotting medications, what you might have noticed or what you might experience when you get the vaccination is just a little bit more sensitivity because your body doesn't clot as quickly as it normally would. Still not a reason to not take your medication, your anti-clotting medications, unless your physician should tell you to do so. So from a prescription perspective, there's not really many medications or any medications that are red light, don't take any longer because you're getting vaccinated. So from a prescription medication perspective, you're good. Keep taking your medications as prescribed, as directed. So I want to do that. From the over-the-counter perspective, you kind of hit on it. There are some concerns about potentially pre-medicating. In other words, taking the medication before you get vaccinated. So we know that sore arm, for example, is a very common side effect after you get the vaccine. And so people say, so I won't have that pain. Let me go ahead and take an ibuprofen, right? What the recommendation is that you not do that. Don't pre-medicate. In other words, know that it's going to happen, but you can take the medication after you've had the vaccination. And the reason why is that the research has shown that taking those anti-pain medications, specifically ibuprofen or the anti-steroid medications, non-steroidal inflammatory medications, is that it tends to tamp down the immune response. And what we want with the vaccine is for the immune response to be full, for you to have the full antibodies and your immune system to really work. And what we find is that when you take some of the anti-pain medications, specifically the NSAIDs and the non-steroidal anti-inflammatory medications, that it tends to lower that immune response, which is exactly what we don't want to happen. And so that's why, from an over-the-counter medication perspective, the one that we really are concerned about is taking the anti-pain medications before you get vaccinated.
That definitely is an awesome, awesome response. And you think about particularly the Black community who has been obviously affected by this pandemic. We have a lot of heart problems, diabetes, a lot of things that have affected us. So with that, the Black community is obviously more susceptible to underlying health conditions such as heart disease, high blood pressure. This has caused much hesitation in our folks. I think the percentage is still low as far as Black people getting vaccinated. So what would you say to these people, and how can you explain the any side effects associated with the vaccine for people who have those underlying health conditions?
Sure. For persons who have the underlying health conditions, speaking directly to them, if they aren't vaccinated, please get vaccinated. That is one way to truly protect yourself, because you're a little bit more vulnerable because you have those other conditions. And for African Americans, sure, we're hesitant at times, but I think awareness is important to know the fact that these medications and the vaccinations, they're treated as medicines. So they go through the FDA through a very rigorous process. And vaccines aren't new. This COVID vaccine is new, but we have decades and decades of experience with vaccines. And overall, vaccines tend to be exceptionally safe. And so for those persons who have other pre-existing health conditions, it's so very important to get vaccinated, because those individuals, if they do get COVID, tend to fare worse than persons that don't have pre-existing conditions. So you want to set yourself up for success. You want to set yourself up to be protected so that you don't have a situation where you may be sicker in this situation should you contract COVID.
Good, good, good. And so let's talk about, obviously, you are a pharmacist. You definitely are someone that if we go to like a CVS or Walgreens, we asking you all the questions, right?
That's
So,
right.
so for folks who, there's different, hearsay about, oh, well, don't go to Walmart to get a vaccine, or don't go over the counter, go to the hospital. Is there really a difference where you get your vaccination from?
Actually, there's not much difference. I mean, it's a vaccine is a vaccine is a vaccine is a vaccine. So regardless of whether you get one at an urgent care, whether you get a vaccine at your community health center, whether you get a vaccine at your community pharmacy, it's the vaccine. And so there really is not a concern, or shouldn't be, hopefully a concern about the location that you get it. Now, you may have a personal preference. You may have your friendly pharmacist who always takes care of you and you feel more comfortable with that individual. By all means, please go to where you feel most comfortable. But persons who are administering the vaccination have been trained. All of us who administer vaccinations have been trained. We know the best way to administer. We know what to look for, what questions to ask before, what information to share after. So you should feel comfortable going to get your vaccine wherever you'd like. But know that if you have a very good relationship with your community pharmacist, they'll be happy to give you the vaccine.
And what about those struggling with the type of vaccine to get? So, there were reports of the Johnson & Johnson vaccine needing to kind of be recalled. What are some things that you would tell folks now regarding the Johnson & Johnson vaccine, especially if that's all they have access to in their area?
Yeah. If Johnson & Johnson is all that you have access to, get the vaccine. If Pfizer is all you have access to, get that vaccine. If Moderna is the only vaccine that's available to you, get the Moderna vaccine. They're all safe and effective. And what occurred with the pause on Johnson & Johnson last month was a show of how our system works. When you have drugs that are approved, there are various different steps in the approval process. There's also a step post-approval, and that step is designed to gather information if people are having side effects, and to determine whether if a large number of people are having side effects, then it may be appropriate to no longer use the drug anymore. We can think of some medications that have been pulled off the market because after long time, periods of time, it's been found that it's not as safe as we would like it to be. Well, in the situation with Johnson & Johnson, in an overabundance of caution, the decision was made to pause using Johnson & Johnson until they could gather more information. And what really happened was, out of more than 4 million doses of Johnson & Johnson, there were 6 persons who had very bad negative effects. So 6 out of greater than 4 million, you have better odds of hitting the lottery than you did of having a bad effect with the COVID vaccine. Now, that's not to minimize those 6 or 7 individuals who had negative effects, serious negative effects to the Johnson & Johnson vaccine. But when you look in the totality of it, the large numbers of doses that were administered, when they pulled all of the data, they found that it's still safe and effective. And it added, for those of us who vaccinate, us to ask some additional questions if you're going to get Johnson & Johnson, just to be sure. But it's still a safe vaccine.
Yes, yeah. And I think for folks who have already contracted COVID-19 and they've gotten vaccinated, they may still be experiencing some lingering symptoms. Can you kind of talk about that as far as like what we should do to kind of get back to our normal with our bodies, our health, our wellness?
Yes, absolutely. I think the most important thing to do is just in general, but specifically in the midst of a pandemic, is to pay attention to our bodies, right? To make sure that we're in tune to body aches. If something seems different than normal, maybe our eyes are watering more, or we're having tingling feelings, or difficulty breathing, or whatever the situation may be. Sometimes we have a tendency to say, that's nothing, right? But it might be something. So it is important for us to always pay attention to what's happening with our bodies and to chart it. And when I say chart it, I'm just saying, in a small notebook or an index card, just write down, what you're experiencing, how frequently, to kind of describe it, make sure you note the date of it, how intense it feels, so that you can then share that information with a health professional. So that they can see if this is in fact something as a result of COVID or not, right? And so I think it's a situation where being more cautious and paying a little bit more attention to those little details is an important thing during this time.
Yeah, and I think just from a personal perspective, I know that a few people that I know have lost a sense of taste and smell. And so their healthcare providers have told them that there is no given date when that would come back. It could be lingering for months until a year, you just never know. So I think with this pandemic being new to us, we just kind of have to go through the motions, but essentially you are pretty much advocating for us regardless to just get vaccinated and make sure that we are taking care of ourselves, right?
Absolutely. I think this, in a situation like a pandemic, it's about taking care of yourself so you can also take care of others.
Yes.
What we know about with COVID and any other infectious disease is that it needs a host. It needs somewhere to go. And so you want to protect yourself by getting vaccinated so that the infectious agent can't host in you, right? So it is so important for us to decrease the number of opportunities that infectious disease has to host. And so I am a huge proponent of getting vaccinated. If persons are hesitant, I'm a huge proponent of them educating themselves. Listening to this type of interview is great. Getting more information is a wealth of reputable, trustworthy information that you can find. If you're going to use the internet, the CDC is a great site that provides non-biased information and plenty of it. And or talk to a healthcare provider. That's what we're trained to do. We're trained to know this information, but more importantly, we're trained to be able to then communicate and share it with others. So I am all about making sure that you get vaccinated and get the information if you're hesitant.
Well, thank you so much, Dr. Easton, for joining us. Again, we appreciate your time and educating the community on all of these pressing questions. And we'll probably have more, so MHSD is also a resource for folks. So visit mhsdla.org for more information. My name's Aria Wilson Harris, Communications Director for MHSD, and we want to tell you loud and proud to protect your neighbor and get vaccinated today.
That's right.
All right. Thank you.
Bye-bye. Thank you. Thanks.